I had one patient and she had the most severe migraines. She could barely function. She needed like 1,000 or more milligrams to get her going and clear everything out. And that cured her migraines.
Wow.
NHANES is called the National Health and Nutrition Examination Survey, and it's conducted by the government. And every year they drive around, they get blood on a whole bunch of people, they test their levels, and they see what's going on of all sorts of things, and nutrient levels. And what they found is, 90+% of Americans are deficient in one or more nutrient at the minimum level to prevent deficiency. And this is really an important concept for nutrients, because if you look at, for example, vitamin D, you need maybe 30 units so you don't get rickets. But you might need 3,000 units so you don't get osteoporosis or cancer or dementia or heart disease or autoimmune diseases or a whole bunch of things that we call long-latency deficiency diseases. There's a guy named Robert Heaney, who was a professor and brilliant scientist, who wrote a paper called long-latency deficiency diseases. And what essentially he was talking about was like, there's nobody walking around really in America with rickets anymore, or scurvy, or beriberi, or pellagra, or xerophthalma. These are these severe deficiency diseases that we actually found in the turn of the century when we started refining our diet and taking white flour and white rice. That's actually how they found it, was in prisoners. They gave them white rice, and they all became deficient, had these horrible diseases that were cured in a second, essentially with minuscule amounts of nutrients. When you look at the amount of deficiencies, whether it's 90+% deficient omega-3, 80+ insufficient or deficient vitamin D, and some people say even more. Magnesium is about 45%, zinc is about 40%, iron. We have a lot of deficiencies, and with Function, we now have 150,000 members at Function Health, and now, by the way, there's no waiting list, so you can just join. Go to functionhealth.com/Mark. You can get in and go ahead and check your levels. But we found that in looking at all the data, almost 70% of our members have a deficiency in a nutrient that is at the minimum reference range of the lab. So in other words, for iron, this is an example, your ferritin level, which is your iron source, should be 45 or more to feel good, to not have fatigue, to not have hair loss, to not have insomnia. There's a whole bunch of things that come with low iron. The reference range goes 16 or lower, but it should be 45. Right? Or homocysteine is just like the level's 14, which should be more 6 to 8, right? Which detects B vitamin deficiencies. Or vitamin D should be probably 45 to 60, not 30 or 20, which some lab reference ranges are. And at the minimum level, which is how much you need to not get rickets or scurvy or any of these diseases, this is what the RDA is. It's not the amount you should be taking, it's the minimum amount you need to be taking so you don't get some of these horrible diseases. We're seeing almost 70% of people are deficient in these nutrients in a cohort of 150,000 people, which is a massive amount of data that we've collected at Function Health. And we're learning about the kinds of things we're seeing in the population. So it's a real issue where people are not getting the nutrients they need, and they don't know why they feel bad. They don't know why they have these low-grade symptoms. I had one patient, she came in, she was a radiation oncology resident at Mayo, and she had the most severe migraines. She was on narcotics, she was on major anti-vomiting medication, and she could barely function. And she came in and she said, I have terrible migraines. And I started taking her history. I said, do you have other symptoms like constipation? Or do you have muscle spasms? Or do you have anxiety or irritability or palpitations or constipation? And she's like, I got all those things. I'm like, well, that's a magnesium deficiency. And it was so easy. And I gave her, she needed like 1,000 or more milligrams of magnesium to get her going and to clear everything out. And that cured her migraines. Wow. And you hear someone who was at Mayo-Clinic, saw their best migraine doctors, did everything she could. They couldn't even diagnose a deficiency. And by the way, magnesium deficiency, we test magnesium with Function, and we get your red cell magnesium, which is a better indicator. But to do a real magnesium loading test where you give people IV magnesium and you see what they keep and what they dump out is the best way to actually really tell. But even so, just by history, I could tell. And after doing functional medicine for 30 years, I can tell you without a doubt, and doing nutrition testing on tens of thousands of people and deep analysis of minerals and vitamins and antioxidant levels and oxidative stress and CoQ10, all the things that people normally don't look at. It's so widespread. Like nutrient deficiency is so widespread in America. So that kind of then leads into the question of, well, if that's true, then why is that true?
By the way, what's shocking about that is 75% of Americans take a dietary supplement. 55% of regular users, yet 70% are still getting those lab results from you. You know,
Right.
so like they're definitely taking the wrong things or
not
not enough of the right things,
Yeah,
you know,
yeah.
like, so I think that just speaks to a lot of the, you know, stuff we're trying to sort out. Subco is giving people the ability to actually know what they're putting in their body.
If you love that last video, you're going to love the next one. Check it out here.